Welcome back, everybody. This is The Globe on SABC News. Now, breast cancer is the most common type of cancer amongst women in South Africa, according to the National Health Laboratory statistics. 1 in 28 women will develop breast cancer in the course of their lifetime. With October being Breast Cancer Awareness Month, we are now joined via Zoom by Prof Jackie Smilg, the chairperson of Breast Imaging Society of South Africa, a subspecialty group of the Radiological Society of South Africa, to unpack early detection and treatment. Professor, a very good evening to you. Thank you so much for joining us. Welcome to The Globe.
Hi, good evening. Thank you for having me.
First of all, Professor, take us through the statistics in terms of the number of women who are affected by breast cancer.
Yes, as you were saying, it affects about 1 in 28 women in South Africa. It's the most common female cancer in South Africa at the moment. And in the urban areas, the figures may be even as high as 1 in 8 women. So it's very prevalent in our population, and it's a very important disease to understand.
Why, though? I mean, why are we at where we are as a result of this? Is it because of early detection or late detection in some instances, or is it because this breast cancer is simply out of control?
I think it's multifactorial. There are a lot of things that contribute towards breast cancer, the development of breast cancer in people. Some of those you can't change. That's related to your age or your ethnicity or your genetic history. But there are certain factors that can be changed that can influence the development of breast cancer. Certain lifestyle factors certainly contribute towards the development of breast cancer. Things like obesity. Obese women are more likely to develop breast cancer. I think our diets that are high in fatty foodstuffs don't help with the development of breast cancer. We should follow a very healthy lifestyle. We should make sure we get enough exercise. So there are certain things we can control and certain things we can't control in breast cancer. But certainly what is very important is the early detection of the disease. Detecting a disease in the early stages allows for much better prognosis and much better treatment.
I mean, you just mentioned lifestyle issues, and I suppose then that women who are at a higher risk for breast cancer based on certain factors should get, a breast MRI or a mammogram every single year. So who are those women specifically who are at a higher risk?
People at a higher risk. Age is a contributing factor. As we get older, the prevalence of cancer increases. There is a genetic link to breast cancer. People who have family relatives with breast cancer are at slightly higher risk, depending on how many family members are affected by the disease. Lifestyle factors, as I say, contribute towards the development. So does your hormonal environment. Early pregnancies can have a sort of protective effect, so can breastfeeding. Certainly, all women, we advocate from the age of 40 until at least the age of 70, should present for an annual mammogram. That is an X-ray of the breast. The MRI you mentioned is not routinely done. It is done in certain high-risk individuals.
Okay,
Unfortunately, in South Africa, we don't have a national screening program for mammography yet, so it's up to the individual to present themselves for annual checkups.
Okay, I want us to talk about the MRI and the mammogram in just a moment. But what are some of the common signs that one should look out for when they want to detect whether they have breast cancer or not?
So there are several signs that you can look for. The most common would be the development of a breast lump, something that is abnormal, that is new and developing. The other things are changes in the skin, overlying puckering of the skin, change in pigmentation or coloring of the skin, and also associated nipple discharges can indicate possible problems.
I suppose those detection mechanisms apply to women. What about for men then? Because they are also equally susceptible to breast cancer.
So absolutely. Breast cancer doesn't differentiate on sex. Breast cancer can affect both males and females. So it's very important for both males and females to be very aware of what is normal for them, and if they detect any abnormality in their breasts, to seek medical opinion.
So what are some of the dangers then that lead to the high risk of being diagnosed with cancer?
Things that can contribute to your risk, as I say, are things that you can't change, like genetic history, but the lifestyle factors, if you have an unhealthy fatty diet, if you don't get enough physical exercise, if you have certain hormonal things. Hormonal replacement therapy has been associated with some increase in breast cancer. So there are a lot of contributing factors, but always to remember that Many breast cancers develop in patients who also have no family history. So although genetics is an important contributing factor, it's not the only factor.
All right, let's talk about the efficiency and the efficacy of mammograms, because I've heard somewhere that mammograms are not really perfect because they miss some cancers, and sometimes a woman will need more tests to find out if something found on a mammogram perhaps is or is not a cancer. Just how efficient are they?
So certainly there's nothing that is 100% guaranteed, but mammograms are certainly the gold standard for early detection and for screening for breast cancer. It is an X-ray of the breast that is performed quite easily and quite quickly with very little discomfort to the patient. Following the mammogram, if there are any issues, there are other investigations that the patient can undergo. We often add an adjuvant ultrasound or a sonar to the investigation to further assess the breast. And then the MRI that you mentioned can be added in certain instances if there is a need.
And there's also the issue of a diagnosis, which is a small possibility of being diagnosed with a cancer that never would have perhaps caused any problems had it not been found during screening, isn't it?
So it's always been said by the people that don't agree with mammography that mammography overdiagnoses and causes undue stress. Certainly any small stress that can develop from a mammogram that necessitates further investigation is outweighed by finding that early cancer if you do have it. The crux of it is to find it when it's very early so that you can do something about it. And we can often reassure people by doing further tests. So people shouldn't be put off by any apparent stress of having a mammogram.
Okay, Professor, let's talk about the breast self-examination. I suppose there is very little evidence that these tests actually help find breast cancer early when women also get screening mammograms. Am I correct?
Breast self-examination is actually not as easy as it sounds. It's quite a difficult thing to do. The breast is changing under hormonal influence as the cycle goes each month. So the consistency and the feel and the shape and the size of the breast can vary from week to week. So feeling your breasts can be quite a tricky thing. Not all apparent lumps will actually turn out to be any lumps at all, or definitely not any serious lumps. But it is certainly something that we can advocate that women start with, making them aware of their breasts so that they then seek medical opinion and mammography or other screening modalities if they think they have a problem.
So would you recommend, a self-exam for just about any other woman, or particularly those women who are at a higher risk?
We say it should be done, but not instead of the screening mammogram. Women should feel their breasts once a month on a regular basis so they get to know what is normal for them and that they're alerted to any changes early. But that certainly doesn't replace an annual mammogram from the age of 40. We very strongly advocate that all ladies from the age of 40 should have an annual mammogram checkup.
All right. By all means, following a healthy, balanced diet is very important in preventing breast cancer. So how then does a healthy lifestyle contribute to lowering the risk of breast cancer?
Many cancers are associated with lifestyle risks, so it's certainly one thing that people can do that can help to lower their risk of breast cancer.
Okay, and to take us through the right dietary plans, one can follow to lower the risk of being diagnosed?
So you obviously want to maintain a healthy weight. Obesity raises your risk of many cancers, which include breast cancer. So you want to make sure you remain within the normal limits for your height. You want to make sure you don't have a diet that is high in fats, because those have been shown to be associated with an increased risk of breast cancer. And a high fiber diet has shown to be very beneficial in helping to lower your risk of breast cancer.
All right, Professor, great chatting to you. Thank you so much for your time. We appreciate it.
Thank you, Anda. Good evening.
All right. Well, that was Professor Jackie Smilg, the chairperson of Breast Imaging Society of South Africa, joining us via Zoom. Let's take a quick break and we'll